Good afternoon, everyone. My name is Jason, and I'm an alcoholic. I am joined today again with Paul Molloy, and we are going to give you a special holiday message. So, with that, I hand it over to Paul Molloy.
Thank you, Jason. My name is Paul Molloy, and I'm an alcoholic. I think that as we're ending the year 2020, everyone can breathe a sigh of relief. 2020 has been an unusual year, to say the least. I think that all of us have managed to exist and continue existing, even though COVID made life very difficult for everyone. I think that one of the things that as we end this year, we can take pride in the fact that most of us have managed to stay clean and sober all year, that we have grown the number of Oxford houses from roughly 2,700 houses to about 3,000 houses. And that was in spite of COVID, which made it more difficult for outreach workers to find houses, made it more difficult for chapters to meet in person, for states and local areas to have workshops to keep everybody up to date. But we all adapted to Zoom, and state after state, chapter after chapter, began to use Zoom meetings to keep in touch with each other. And as is always the case within the Oxford House family, lots of innovation. Some chapters said, we'll give you a $25 Amazon card if you show up on a Zoom call. There's a chapter meeting. Others said, we'll talk about food, even though we may not have food and may not be able to break bread together because we're afraid of transferring the virus. We have had some deaths, 3 deaths within the Oxford House family as a result of COVID. And we've had roughly 257 COVID cases. That sounds like a big number. It is a big number, and it is a sad number, but we've had more than 40,000 people go through Oxford House during that period of time, from the beginning of March until today. As people have come and gone, there's 23,000 beds in Oxford House. And over that period of time, about 40,000 people have gone through Oxford House. Most have stayed clean and sober, and some have picked up COVID. One of the positive things is that, as far as I know, all the landlords have been paid their rent in spite of COVID, in spite of the fact that some have been unemployed because their jobs aren't there anymore. Nevertheless, everyone worked together, paid bills, and kept houses on track. That's important. It's important for us as individuals because we can take pride in that. It's important for society at large because during this same period of time when there's been lots of COVID deaths, there's been about 80,000 people who have died because of an opioid overdose. The news media sometimes forgets about the fact that alcoholism and drug addiction continue day in and day out, even though the headlines are all about COVID. Now, as we see light at the end of the tunnel, the 2 vaccines that have been approved by the Food and Drug Administration are soon going to be reaching people. In my case, because I'm 83, it's going to reach me faster than it will reach many of you. But within the next 2 or 3 months, all of us are going to have an opportunity to get vaccinated. And I want to encourage everybody get the vaccination. It is safe, it's effective. The flu vaccination that we have each year is about 50% effective. This one, after testing it on 40,000 people, is 95% effective. That's a remarkable success story. And soon, everybody will have that vaccination available to them. Healthcare workers, old people like me, folks in nursing homes get first crack because we're the ones that tend to die fastest if we get COVID. But soon it's going to be available at the CVS store, at the Walgreens, down at your local drugstore. The same way you go get your flu shot, you're going to be able to get a vaccination for COVID. The sooner we all get vaccinated, the sooner this terrible disease goes away. Once every 100 years, these bad things are likely to happen. We happen to be around when it happened. And everyone in Oxford House needs to be very proud of the way we responded, because we responded as a caring family, taking care of each other. And when someone in a house had COVID, we isolated them in a separate room. We didn't spread it from one to the other. Now, during this last year, 2020, we established 318 new Oxford houses, 213 for men, 105 for women. That's remarkable. It's remarkable, particularly because of COVID. It's remarkable that we kept going and reached out to help folks getting out of incarceration. We continue to help folks getting out of treatment. Now, many treatment providers had low population. Their census was down because of COVID. We weren't able to go to AA and NA meetings in person where we normally tell people about Oxford House and find folks who need a place to live. But in spite of that, we still have managed to keep most of our beds full. And as you go on oxfordvacancies.com, you'll notice there's about 13% vacancy rate among houses. That's about what we normally have. That's the turnover. People moving out, other people moving in. So as we look forward to 2021, all of us need to be thankful for having survived 2020. And we can look forward to reaching out, helping even more folks who are recovering alcoholics and drug addicts. Last night, the Senate passed an omnibus bill that funded the federal government. Part of the good news about that is that more money was provided for substance abuse and mental health than ever before. One way or another, Oxford House is likely to be the beneficiary of some of that money, because state after state will have seen what has happened. They'll see the 3,000 houses we have out there now, the 40,000+ people who've gone through Oxford House, the high success rate, and they too will want to develop networks of Oxford Houses. And with the money that's in this bill, they'll be able to afford to get outreach workers into the states to help extend the network of Oxford Houses. You know, I always talk about we really need 70,000 Oxford House. Jane has gotten me down to saying 10,000 Oxford Houses. I suppose I'd be satisfied with even 5,000 Oxford Houses. But Oxford House saved my life. I know many of you feel it has saved your life. And all of us know we have friends who are hooked now on booze and drugs who need to buy the time and peer support provided by Oxford House. So as we are 2 days now from Christmas, we're looking forward to the new year. Celebrate quietly. Don't go out into large crowds. Remember to wash our hands, to wear a mask, keep 6 feet distant. Do all the things that we've done up till now to keep this terrible virus under control. And as we look forward to 2021, watch the papers, watch the news, find out when that vaccine will be available in your area. Because as soon as it is available, get the vaccine. When 70% of us get that vaccine, the virus is going to have no place to go. and we will then be back to normal. Maybe in time for baseball season. I know the Nationals are anxious to again show that they can win the World Series. But I suspect even now, down there where Jason is, the New Orleans Saints are anxious to have crowds come and watch Drew Brees play and get back on a winning streak. But whatever your sport, whatever your ambition, we in Oxford House know that next year's convention will be in Washington, D.C. It will be in September. Start planning for it. And with the grace of God, we'll end up in a virus-free world where we'll be able to go forward with that convention. We missed the convention this year because one of the things that a successful family loves is to get together and share our experience, strength, and hope. A few more months, 9 months until next September, but then we'll all get together. In the meantime, stay safe, have a wonderful holiday, and thank God for the fact that we're clean and sober today and that Oxford House is alive and well. Merry Christmas, Happy New Year.
Thank you, Paul. And I'd like to wish everyone a Merry Christmas and a Happy New Year from everyone at Oxford House Incorporated. God bless.